Welcome to the show, Medicine That Matters. We'll be taking you towards an extraordinary journey, diving into new frontiers of medical technology with the help of leading experts around the world. Going back to basics with herbs, nutrition, and holistic living, providing you with facts, not fears, and helping you spread real information, not propaganda. According to the new study by scientists at Wake Forest University, drinking beetroot juice may cause wonders for your brain health. To discuss this further, we met with Dr. Lydia Brown.
Beets naturally have a high content of nitrates, and it converts to nitric oxide, and nitric oxide dilates the blood vessels, including the blood vessels of the brain. And also it's something that helps to be a messenger between the brain cells. And there are studies after studies showed that it increased blood flow in the elderly towards frontal lobes. And one study showed that older individuals with hypertensive, they were exercising and consuming beetroot juice before exercise. And brain scans showed that neural networks of these older people with hypertension function as well as neural networks of younger folks. So it helps the neuroplasticity of the brain. So I think we all effectively have to take beetroot juice. And so the amounts that were quoted was 16 ounces or 140 milligrams of beetroot juice.
How much is that, like 1 glass?
2/3 of a glass.
2/3 of the glass. Okay, I can do that.
Yeah, so I think it's just a very simple, natural way to enhance your brain and your abilities.
Antibacterial soaps were initially introduced in 1960s for hospital use. However, with tremendous marketing efforts and public scare tactics by manufacturers, they were soon everywhere for domestic use. It quickly became apparent that they were no more effective than regular soap and actually were causing more harm.
The FDA finally issuing a sweeping ban on 19 ingredients commonly found in antibacterial soaps, saying we have no scientific evidence that they're any better than plain soap and water, even going further, citing data that suggests the ingredients could pose health risks, such as bacterial resistance or hormonal effects.
There were studies done that showed that after using an antibacterial soap, for example with triclosan, that within 2 minutes the bacterial growth was as much, if not more, than it was prior to using it. Some of the byproducts of these soaps could affect hormones in animals and obviously in humans. There may be other possible risks of even carcinogens in these soaps. Soap and water, the usual kind we buy at the supermarket or the pharmacy, can be used very effectively for cleansing. A more effective means of cleaning the hands essentially 100% for a while, for maybe 2 or 3 minutes, is using the alcohol or alcohol solution. Ethyl alcohol, 70%, very effective if you're exposed to people with respiratory infections or people who are perhaps at risk of spreading infection. Using that on the hands, it removes essentially all bacteria plus many viruses, especially the respiratory viruses, very effectively. And if you do that, you'll prevent spreading infection.
In 2011, a 911 call was placed from residents of Demi Moore. She was experiencing convulsions due to nitrous oxide.
Demi Moore hospitalized for what her spokesperson says is exhaustion. Family and friends rushing to her side, and we're learning new details about what led to her being rushed to the emergency room.
There are so many conflicting reports about what led to that 911 call. Everything from prescription drug use to new reports she was taking nitrous oxide or whippets.
Nitrous oxide is an anesthetic gas, first synthesized by Priestley in 1772. In the 18th century, they found it had anesthetic properties, but additionally found that it had euphoria-producing effects, and they actually had parties arranged around what was coined the name laughing gas. It's available almost virtually everywhere. Amazon, the internet, you can order in bulk small canisters of it. And certainly the industrial use, such as whipping cream, will never be able to produce controls on all these different avenues.
There is no regulation in this field since the gas is not on the restricted substance list. Doctors have urged related departments to tighten loose ends.
A lot of young people have taken to nitrous now for highs, and patients get what we call momentary high, lasting 30 seconds to 1 minute. They inhale the nitrous through something called whippets. So it's a canister connected to an empty whipped cream bottle. That's hence the name whippets. And they will inhale this very quickly and they'll get a momentary high. But when you accumulate it and you binge on it, it will deplete your B12 levels. And B12 is a very important cofactor for nerve function in the brain and the spinal cord primarily.
B12 deficiency will produce neurologic damage by a separate mechanism, combined neurologic degeneration. They
cannot walk well, they have total what we call ataxia. They lose their ability to know where their body is in space. And when we've made the diagnosis that this is not MS or Guillain-Barré or anything, that it is due to nitric oxide, they obviously have to discontinue the nitric oxide right away, but we replenish the B12. And we've seen patients recover, but sometimes it's not a full recovery. So these kids can be left with devastating neurological complications and disability.
The take-home point would be that this is a very dangerous drug. The risks for anoxic brain damage, it's irreversible. There's not a thing we can do to reverse it.
Medicine is finally catching on. So what are the technologies that are going to change healthcare as we know it?
3D printing has entered the world of reproduction. Bioprosthetic ovaries have been surgically implanted in mice and produced healthy pups in a Northwestern University lab.
Researchers in UAB and Northwestern University have successfully created 3D printed ovaries. By removing a female mouse's ovary and replacing it with a bioprosthetic ovary, the mouse was able to not only ovulate but also give birth to healthy babies.
The real breakthrough here is that we're building a true ovarian bioprosthesis, and the goal of this project is to be able to restore fertility and endocrine health to young cancer patients who have been sterilized by their cancer treatment. Right now we're able to do that with young mice, and the goal ultimately is to provide this back to patients.
Thank you for joining us for this episode. I hope you learned something valuable today. We want to hear from you, your concerns, your questions, your stories, and what do you want to watch in future episodes? By emailing us at medicinethatmatters@gmail.com. Let us build a healthier planet together.